Good afternoon and welcome to this webinar. It's a partnership approach between Cover Colorado on behalf of their members with Connect for Health Colorado. Lots of C's and Colorados in that. This is Marcia Benschoof and I'm part of the training team at Connect for Health Colorado. I'm joined today by Johanna Hermes, who's also part of our training team. So we're very grateful that you chose to spend your noon hour with us. We will go through a number of slides in the process with you today. And then we'll open the chat line up if you would post questions in the chat line while we're speaking. We'll go ahead and spend about 20 to 30 minutes answering your questions. And then those that that we're not able to answer, we are capturing all of the questions that you submit, and we'll be sending those over to Cover Colorado to help answer and disperse back to you. So again, thank you so much for joining us today. We're very appreciative of your time. So let's get started. Thank you. So just a few notes on today's topics and what we'll be covering. We do want to provide you with an overview of Connect for Health Colorado. This will be brief. We know many of you have spent time really thinking through this and are very conscious consumers of health insurance, but we want to give you a brief overview. We want to spend a significant amount of time talking about the medical assistance programs that are available in Colorado and those specifically geared towards assisting with the payment of premiums on the marketplace. We want to introduce you to a quick eligibility calculator to check to see if you are eligible for financial assistance. And so we want to provide that tool and talk through that with you. We do want to talk with you about how to find and associate yourself with a broker or a health coverage guide. We have a vast network of statewide advocates and advisors, and so we want to make sure that you know about them and how to find them. We know that searching for a medical provider is very important to people who are shopping for insurance. It's one of the top 2 questions right after can I afford it? And so we want to show you the mechanisms on our website about how to search for a medical provider and make that selection. And then also very important for purchasers of health insurance is the medications that you or your family members may be taking, and how to determine if your prescription is in a plan's formulary. So we'll talk about that as well. So what is Connect for Health Colorado? We are a competitive marketplace for the purchase of private health insurance. We are pure and simply a marketplace, a store where where we host carriers' products. We are also the exclusive way to get the new financial assistance to help reduce the costs, both month-to-month premium, as well as a second layer of financial assistance that addresses out-of-pocket expenses. But we are the exclusive way to get those. They are effectuated through the Internal Revenue Service, but we are the administrator, and we help with the eligibility determination to receive those financial assistance dollars. As I mentioned, we have a broad statewide customer support network. We were very fortunate to be able to recruit and certify about 1,500 brokers. Likewise, we have an assistance network. You may have heard the term navigators if you have been listening in the media or even studied the Affordable Care Act. We call them our assistance network. There are 55 assistance sites across the state of Colorado, and through them they are the employer or contractor for over 500 health coverage guides. We don't call them navigators. In Colorado, we're very proud libertarian state, so we want to name our own people and resources. So they are called health coverage guides. Likewise, we've done another outreach beyond those 2 groups to folks who already work in helping professions, notably hospital enrollment or admissions, provider admissions folks. And so we have gone ahead and trained and certified them. They're referred to as certified application counselors, and there are over 1,000 of them. So while they're not actively out advocating and enrolling people, they are trained and certified by us to know about what our services are and what the financial assistance can look like so that they can resource that to folks who they encounter. So together we have established an over 3,000 strong Army to help with the outreach and education, advocacy, advisement, and enrollment. So we hope that through our education with you today and through your own sort of outreach and interface efforts that you find the help that you need. If you don't among those people, rest assured that we have a customer service center. We have employed about 180 frontline folks in our call center, which is located in Colorado Springs. And so we also have a very adept and ready to help service center staff. So together that comprises our customer support network. We did open on October 1st, so we're almost 2 months old, and our focus in the market is, from the beginning, is individuals and families, and then small businesses. And small business in Colorado is defined as 2 lives to 50 lives. So that's really our focus for several years. That the access to the marketplace may expand in 2016 to employers who have 100 lives, and then in 2017, any sized employer can come through the marketplace and use our employer features to establish a group insurance plan for their employees. One of the most important things as a marketplace was for us to have products to sell, because the worst thing would be to open a store and not have anything on the shelves to sell. So we did a lot of work with the carriers in Colorado to make sure that they understood how seriously we wanted to partner with them and how important it is to our mission. Our mission is to provide access, affordability, and choice to individuals, families, and small employers seeking to have health insurance. And so we wanted to be sure that we had not only a fair representation, but a significant representation of carriers as well as benefit plan designs. And so you see here on the screen the names of the insurance carriers that have products on the individual marketplace. And so many of them are names that you know. There are several new players in Colorado, and I'll note them. Colorado Health Op, which is our co-op. It's a consumer-operated and oriented health plan. It's kind of like the REI of an insurance company, health insurance company, owned and operated, governed by its consumers. And it is new to the state. And then several of the traditional Medicaid payers and claims administrators created the ability to also provide commercial insurance so that they could really stabilize the market of folks that qualify for Medicaid, but maybe through a life event may then not qualify for Medicaid but still need insurance. So it's a continuity of coverage strategy for companies like the Denver Health Medical Plan, as well as Access Health Colorado. So some very positive moves in Colorado towards having a significant number of carriers represented, and then those carriers together have 150 health plans, so plan designs for individuals to choose from. So we also, in that box on the right side of your screen, you see dental, and you see the companies that are offering dental through standalone dental coverage. So some dental is embedded in the health plan, but back to that choice equation, some individuals and families want to purchase standalone coverage, and they want to make a separate choice of carrier between what their medical plan is and their dental plan. And so you see the carriers that are offering dental there. And we're very happy with these results on a per capita basis. This is the most significant representation of plans and carriers of any marketplace in America. So you can be very proud of Colorado, and we think this will serve the citizens of Colorado very, very well as they seek to find the right carrier, the right benefit plan for their families and individuals and small companies. So there are some key dates here on your screen for individual marketplace open enrollment. So for individuals and families, it really is imperative that they are shopping now for coverage, especially if they want coverage to begin January 1st. So the deadline for enrollment is December 23rd. You may be aware that that date was the 15th, but there was a federal guidance that was sent out on last Friday morning, that said, nope, we're going to have 8 more days before that deadline for enrollment. So it is now the 23rd, which is very good news because it's a busy time of the year anyway, and there's a lot to think about and plan for. So the final enrollment date, in order to have coverage in force by January 1st, is December 23rd. Then that coverage would begin January 1st, and then open enrollment ends for individuals March 31st. So if you have coverage that doesn't end until February, you're not ready to make that decision, then you have until March 31st. We do know that Cover Colorado members have another set of dates in your mind, and that's the date that Cover Colorado has requested that you notify them of a disenrollment or that you're moving your coverage, and that's a December 10 date. And we'll talk about that in a few screens. But you have an extra set of dates, and we're aware of that. So in terms of an overview of medical assistance programs, really for those of us who've spent our insured lives in the commercial market, we haven't thought much or ever had to interact with medical assistance programs on a personal basis. And so it can feel kind of disconcerting and maybe even not something that you'd prefer. But we want to give you a little bit of background, because with the advent of the marketplaces, that world did expand, and it actually created more of a permeable relationship between the commercial market and formerly, state and public assistance programs. So it's a little bit of a new world, and we know we're all getting used to it, but we want to give you some of the backstory there to maybe aid your level of comfort with initiating this process. So because of the new law that came into effect and the marketplaces began in October, the realm of financial assistance programs did expand. So before October 1st, folks could get health coverage if they were financially unable and they qualified for Medicaid or the Child Health Insurance Plan, or CHIP. And then the marketplaces came, the exchanges came into being, and a third option or third availability of assistance to pay for medical premiums and costs came into being. And so you see there in the blue box that now the exchange or the marketplace, they're synonymous terms, we have the ability to assess eligibility and to administer advanced premium tax credits and cost-sharing reductions. I'll spend a few slides talking about what that means, but this slide I really want to pay service to taking maybe the old world and making it into the new world, and so coming forward with some of our maybe negative feelings about seeking assistance. Purchasing insurance is a significant purchase, and so having these tax credits available is very positive. At the end of the day, a person can see if they qualify for financial assistance by completing an application. You can complete the application in Connect for Health Colorado's website, which I'll talk about that process, and we hope that you do, because we would like for you to establish an account so that we can help track that process with you and for you. And we can help your broker or health coverage guide also advocate for you in that process. But an application can be done in one of 3 ways. It can be done online, and we're an online marketplace. That's the preferred method. It is what's called a SMART application. So if some of the questions don't relate to you, then you can skip through the application, whereby if we do it a paper app, then you're sort of left doing all the questions and not knowing which one doesn't pertain to you. Or we can do it by phone. Again, our service center is ready, willing, and able to help enroll folks who maybe don't want to go online, or they don't want to do a paper app, but they want help getting through that process, and we can do that by phone. I'm sure your broker or your health coverage guide can also speak to you over the phone about that. So it's really a three-step process when we're looking at determining eligibility for these various programs. And the intent is really to make sure that the right folks get the right assistance from the right location or the right program. Those of us and all of us are tax-paying citizens, and so at the end of the day, those dollars generate from us if you follow the money. And so it's really important that there be discernment, clear and definitive discernment between folks who should receive Medicaid, or kids who are eligible for CHIP, or people who are eligible for advanced premium tax credit. Nobody wants to have confusion or double benefits or no benefits, and so it is a very clear process, but it is a three-step process that involves, number one, getting a Medicaid denial, which basically unlocks the key. You would get a denial number, and that would unlock the advanced premium tax credit eligibility. So we'll talk a little bit about that. Again, the blue boxes are available from the state of Colorado, and advanced premium tax credits and the cost sharing reductions are available through us. We are not a state agency. We're an independent from the state, but we are a nonprofit. So basically, customers can only be eligible for one program. That's that duplicity and redundancy that we want to avoid. So the ability to have financial assistance is based on income. Specifically, the advanced premium tax credits available through the marketplace, through Connect for Health Colorado, are based on modified adjusted gross income. So it's gross income, not assets, which is an important distinction. But the new tax credits are really based on that income. And so the incomes are really, these are translated from the federal poverty level. So the individual earning about $15,000, which is 133% of the federal poverty level, to 400% of the federal poverty level, which equates to $45,500 a year. Not many of us carry around federal poverty level percent in our back pocket, so that's why we felt like this screen was very important to help you gauge where you may fall in this spectrum of being qualified for some measure of premium assistance. So it would be obviously a sliding scale. So the lower your income, the higher your assistance dollars would be, and so on. You see here a couple earning between $21,000 and $62,000. So that's a lot of that. Many couples could qualify for some amount of assistance. And then the final example is a family of four, and 400% of the poverty level, federal poverty level for a family of four equates to $94,000, which is a significant income, but it's also that family of four covering them is a significant expense to the family. Again, the tax credits are applied by the IRS, and the amount that anyone gets along that spectrum is tied to the cost of a benchmark plan, which in our state was a Kaiser plan. So let me just tell you that the way that these are effectuated, that if you came through our system, you filled out your account, you started shopping, you get to a question that asks whether you want financial help paying your premiums. It goes into a co-branded Peak site, which I'll show you this process. I'm just describing it now verbally. You complete the Medicaid application, you are denied, and that happens in real time now, most cases. We've progressed. You then, you know the plans that you want, or maybe you then shop for plans and you get a tax credit, an advanced premium tax credit. That amount will net against your monthly premium. So you won't be in the position of getting a gross amount and having to pay anybody back. That is between the Internal Revenue Service and the carrier. So it happens in the background. I've mentioned a few times the cost sharing reductions, which is an additional level of financial help that the citizens among us at the lowest levels of income can qualify for. And those are for what we call out-of-pocket, so a copay or a deductible. So you see here the ranges of folks who would qualify for some help with out-of-pocket costs. And that also happens in the background. So that information goes to the carrier. And let's say you're an individual and you earn $15,000 a year. And so your copay, and this is just an example, your copay, a normal, not normal, but a consumer who's paying full freight without an advanced premium tax credit for the same plan might have a copay of $30, which is pretty common, but you would qualify for the cost sharing reductions. Maybe that becomes 10. And so again, that happens in the background, and you see those amounts in your policy documents and on your wallet card. So how do you apply? I sort of ran through this, but let me slow that down a little bit because it's very important that we go kind of step by step together today. So number one, we recommend that you do a quick eligibility check. We have a calculator that we're going to show you how to find it on our website, and it has a medium level of information, but it gives you a better indication than some of the very quick calculators. So it asks for a little bit more information, but it gives you a greater detail of an estimate that you might, that you do qualify and the amount you might qualify for, so that you can make a decision about whether you go through the financial application process, that Medicaid denial process, or maybe you don't. Number two is you get to choose. If you are eligible for a tax credit, you can take it monthly, so that means that if you do want it netted against your monthly premium, and it's significant because this is a cash flow decision you're making, then you do have to go through the Medicaid declination process, which we call the financial application, and then you would proceed through these steps to get your advanced premium tax credit, then shop for your plan and enroll. If you want to take it in a lump sum at tax time, you don't go through the financial process. You come onto the marketplace, you fill out your account, you would pay the full monthly premium, and then you receive the tax credit on your annual tax statement. The IRS is revising their tax forms to include line items to capture this so that you can be sure to get your tax credit at tax time if that's what you prefer. If you go that route, and many of you may, the plan has to be purchased through the marketplace. So that is the qualifier to either receive the upfront tax credit or the year-end tax credit. A couple of the benefits for just skipping the financial application and taking the tax credit later. As I said, it's the non-financial path that you would take. That's shorter by about a half an hour now. We are making the whole thing faster. So to go just straight through the regular shopping experience takes about 30 minutes. It's gone quicker for people who are, have all their paperwork and know exactly what plan they want. But if there's some shopping involved, it may take about 30 minutes. You would pay the full monthly premium. You would receive the credit on your taxes. You don't need to report income changes during the plan year. If you were to proceed with the advanced tax credits, we ask that customers who have those report income changes through the year of plus or minus 10% to us, because we would like to help make sure that that the IRS doesn't have a huge amount of money to come back and get. So an example of that is if your tax credit was based on you making $25,000 a year, and then for some reason you got a great job and you were making $44,000, you would still qualify for a tax credit, but it would be less. If you continue to get the tax credit at the higher rate, the IRS will expect you to pay that back through the process of your taxes, and that's called a clawback. Not our term, but we would like to help people avoid that, and we would like to help them navigate that. So we are asking to help with that, and our service center is the mechanism for that. There is no payback or reconciliation of the advanced premium tax credit if you're taking it at year end, because it's all sort of reconciled there at tax time. And then the cost sharing reduction, if you qualify, if you take your tax credit at the end of the year, you can't get a cost sharing reduction. That's only on an advanced tax credit basis. Let's talk about the quick eligibility check that we talked about, which is sort of a medium length, about a page and a half calculator, but it'll give you a really good idea of whether you qualify and how much you qualify for. So you see there the link, http://Connect for Health Colorado Get Started, which is a tab at the top of our website. You would drop down to Health Coverage Guides, and then you'll see a category or a heading that says Help Customers Calculate Savings, and then there's a link. It's blue, like all good internet links, that says Tool. If you click on that, up comes this questionnaire. As I said, it's about a page and a half. And if you fill that out, it will really give you a very good indicator of your eligibility and the amount. So you can make a decision based on which path you want to take and whether you qualify. So we estimate 3 outcomes arising from the use of this tool. Number one, it doesn't seem like you're eligible for advanced premium tax credit, and you want to still shop and you go straight through the non-application process. You may be eligible for it. It may determine that you're eligible for a small amount of tax credit, and you would be the decider about what's small for you or large for you. And then you can make a decision about whether you want to take the tax credit at tax time, or you want to go ahead and see what that net effect is on your monthly premium. And the third outcome is that you're eligible for a substantial amount, and you do want to apply it to your monthly premium. So to apply for monthly assistance, if you want to receive the monthly tax credits rather than waiting until the end of the year, these are the steps that you would follow. Again, as I mentioned, you would create an account on our website that's your very own account. It's very much like setting up a website on any other shopping website that you're familiar with. There is a question there that says, are you getting assistance? Are you getting help with this process? And that will lead you to associating. We call it associating yourself with your broker or a health coverage guide if you want help. Both of those mechanisms for assistance are free to you. You don't pay for them. The second step is that you start the financial assistance application, as I said, in our co-branded Peak/Connect for Health Colorado site, and then you get a determination. Once you've received a denial for Medicaid, then you'll be given what we call a denial number. It's here referred to as a CVMS case number. It's also called a 1B number. And then you use that to complete the rest of the application. Our site will ask you, do you have a Medicaid denial number? And you put that 1B number in there, in that field. You put it in exactly as it is. Don't cut and paste it. Just put it right in there, cap sensitive, and then that unlocks the advanced premium tax credit, and then that takes about 10 minutes. So a little bit more about applying for medical financial assistance. we're using the state's online portal, which I refer to as PEAK. That's the very first process. And you can you reach it through our co-branded site. You can't bypass the Medicaid application if you want to apply for that monthly advanced premium tax credit. So if you really just don't, if you hate the idea of going through Medicaid, or you just don't want to, again, if you want advanced premium tax credits, you don't really have a choice but to do that. Then you can shop on our website, and this is the individual shopping page. So you see this family, and as the indicator that you're in the right place. It says individuals and families, and you see here where we have circled Shop Now in red. This is where you would go to set up an account or sign in if you have an account. And then once you've signed in or you've set up your account, the very next screen says Shop Anonymously through Browse Plans. And so you can find a plan beginning then. Here's just what that created an account looks like. We wanted you to see it's pretty straightforward, and it takes about 5 or 10 minutes to set up your account. You see at the top in blue where you would select My Account, and then it takes you through a quick account creation setup. I mentioned once you sign in to Connect for Colorado, then you have to go back in and set your username and password, and then log in. And then at that point you can associate your account with your broker or health coverage guide. So why do we do this two-step? You may have heard a lot of media attention around security and privacy. And this is one of those. We have a couple double steps in our system that feel kind of clunky and maybe not very intuitive. And we understand that. We hold your security and your privacy sacrosanct. And so in order to make sure that the account is fully established, and then the person who set up the account knows how to get back into that account through a username and password, is an additional step that allows us to make sure that we're as secure as possible. So please understand, we're not trying to hassle anybody or make it, real cumbersome, but we do hold security and privacy above all. So you do have to be logged in to associate your account with your broker or health coverage guide. You do not need to be in your account to find one of those people. So you see here that we're back at the main page of our website, and if you're just like, I don't know, I need help, I can't figure this out, I number one want to figure out if my broker's a certified broker with the exchange, or I want to find a broker if I don't have a relationship, or I want a health coverage guide. So at the very top, there's this tab called Get Assistance. You click on it, and you have the choice of chatting with our customer service, so you can hit that and you will be entered into a chat session with our service center. Or you hit Find a Local Assister, and it'll then ask you if you want a broker or a health coverage guide. So the difference between a broker and a health coverage guide are, there's just a few distinct differences. Brokers are licensed. So they are licensed through the Division of Insurance, which is the Insurance Regulatory and Consumer Protection Agency for Colorado. They can act on your behalf, so they have an agency relationship with you, and they can act as if they are you from a legal perspective. We call that acting on your behalf. And they can provide recommendations to you based on your unique needs. So they blend their knowledge with what they know from the market knowledge with what they think, what they understand you to want, and they're giving you advice and recommendations. That's different than a health coverage guide. A health coverage guide is more of a resource and an educator. They can explain general industry information. They can help you navigate through the application process. They cannot navigate for you. They can't act for you. and they cannot do anything on behalf of you, and they cannot make recommendations to you. They can give you choices, and they can help you narrow those choices, but they cannot give you recommendations. So we tell you these things not to limit you, but to give you the background about making a decision for yourself and what level of assistance you need and who the most appropriate path would be based on your needs. So let's say that you want to find a broker and you hit that Get Assistance button, and then it said find a broker, an agent broker, and you clicked on that. You would come right here. You would put your zip code in, and then if that's all you knew, you would hit search, and up would come all of the certified brokers who offer services in your zip code. If you did know, like obviously you know your own zip code, but if you also knew your broker's last name and you were just wondering if they were certified and you wanted to associate yourself, you would say, you put your zip code in, and then you would put the broker's last name. So let's use my last name, Benschoops. You would put that in there, and then you would hit search, and all the Benschoops in the whole world would come up, all one of us. And then you would click on my name, and you would associate me, and that would be all you needed to do. By the same token, if you wanted to find an assistance site, again, there's 55 assistance sites, so you would be selecting at the assistance site level. And our assistance sites range from being faith-based to being business-focused to being focused on particular populations based on diagnosis or a condition. So they really run the gamut. And so, again, if you wanted an assistance site, you would put your zip code in, and then you would hit search, and then up would come the assistance sites in your area, and then you would reach out to them, and they would assign a health coverage guide to you. So you see here, authorize a health coverage guide. The assistance site actually does that. These are the search results for finding an assistance site. So let's say you're back in the application, so you're proceeding through the application process at this time. So right now to this point, we've created an account, we have designated an advisor, and we have associated ourselves in our account, and then we're ready to start shopping. So you would come to this slide, you would come to this screenshot, and at the top of this screen is actually the privacy statement. You would agree to our privacy and security statements, and then at the bottom of that are these two questions. This is how you start the financial assistance process. So the question at the top you see is, do you want to find out if you or your family can get help paying for some or all of your health insurance? You may have done the quick calculator, and that quick calculator indicated perhaps you could get help between $100 and $400. That's really a great cash flow help to you, and so you're going to say yes. That's the very first process. And then the next question is, have you been denied Medicaid or CHIP on or after October 1st? And you would most usually say no, you haven't. And then you would hit that continue button, and you will enter into the co-branded Peak website to continue the Medicaid application process. Peak and Medicaid, Peak is the kind of quick system for evaluating Medicaid eligibility. So you see here the categories of questions that you're going to be asked in your Peak application. This application is taking anywhere from 30 to 45 minutes to complete. It has been refined in the last 45 days, and so there's just a lot more online intuitive background to it to help people get through it faster when there's questions that don't pertain to you. But these are the categories. We give you these so that you know kind of what the time frame is, what you need to do to prepare to fill out the application so that you can get through it in one sitting, and so that you have documents available to you. So I mentioned that the financial assistance programs are based on income, not assets. And so you see here several times that there's a reference to assets. assets come into play in Medicaid if you're considered, or if you consider yourself disabled. There's a separate set of questions that you'll be asked to answer, and it has to do with allowing more benefits, not less. But they do ask a couple questions about specific housing bills and liquid and other assets. So once you're done with the PEAK application process and we're ready to proceed to get the advanced premium tax credit and cost sharing reduction application completed, you'll get that case number that I talked about. It's a 1B number. In about 90% of the cases, it's a 1B number. Medicaid also uses a 5B number, and that's just a very specific time when they do an update and a project to really get their backlog basically over and resolved. So you may get a 5B number, but usually it's a 1B number. And so you would put that into the screen where it asks for it on our website, and then you would proceed. And then we do have several videos for you. They're no longer than 2 minutes each, and they will be posted, or they already are posted, on Cover Colorado's website, so that you can watch those very rapidly, and it'll make this even more crystal clear than I'm making it for you today. But they do illustrate with an account that's already created how you enter that 1B number, how you fill out the financial application, what it looks like to receive an advanced premium tax credit, and how that shows up when you're shopping for plans. So these are really, really great videos that we produced just for you. There are many decision support tools when you're shopping, and we wanted to just highlight several of them for you. So as you come back and you're finishing shopping, you'll see a screen that says Family Health Status and Planned Medical Expenses. So I want to be very careful about explaining these sets of questions to you. They are only for you to plan for your expenses and the type of coverage that you need. None of this information gets transported to the carriers, and no longer does health status or pre-existing condition impact the premiums or the coverage that you can get. So you may know that that having a condition is not a pre-existing condition is not a reason for a carrier to decline you or for your premiums to be higher. Premiums are now based on where you live, so where care is rendered, and those are called regional service areas, rating areas, and then what age you are. And so there are 3 age bands. There were 6. And the only really health-related question that you're ever asked is whether you use tobacco. So after all those qualifiers, let me tell you that these screens are actually very good to help filter through and to help think through what type of coverage you want, what deductible you may need, and what carriers may be fit best for you. It's just for you. It does not go anywhere. You see there, skip and view plans. You don't have to do this. This is just for planning. So these questions are totally optional. We talked about searching by provider. And so after creating an account and when you go through getting started, you get to a question, do you have a doctor or hospital that you want to keep using? And you select yes. And then you can continue, and it'll show you where you can put the search by provider. You see on the left-hand green box, there's some filters, and one of them is searching by provider. What's great about our provider search feature is that before this search feature came into effect, us as consumers would have to go onto an individual carrier's website. So again, if I wanted Dr. Benshoof, I would have to go into each plan's website and search for that doctor. through the marketplace, you actually put the doctor in first, and up come all the health plans that that physician is affiliated with. You can put up to 2 providers. So if you have a primary care provider and then you regularly are involved with a specialist, a cardiologist, or any other specialist, then the search feature can search on both of them together, and the plans that come up with their complement are identified for you. Likewise, if you treat at a facility often or a hospital, you can search by that hospital and all the plans come up. So you don't have to go through the arduous task of one by one. They come up for you, which I think is very, very nice feature for the search filter. Also, the formulary is important when we talk about the preferred drug list. So after you're searching and when you're shopping, you see here 5 health plans that meet the initial profile of what this consumer wants out of a plan. And then we have circled where under the column plan details, you see a preferred drug list. You would click on that. And in some cases, the carrier has a static page with their formulary. And in some cases, they have a hot link onto their website, onto their formulary. This is an area that we want to make more robust and specific. But for right now, the formularies are accessible during the shopping experience. But some of them are static pages and some of them are dynamic formulary lists on the website that you hot link to. So key takeaways from our time today, we really want to encourage you to use the quick eligibility calculator that we talked to you about finding and using to help you discern if you're eligible for financial help. If you are eligible, think about whether you want to take the tax credit on a month-to-month basis or at year-end. We hope that you will find a broker or a health coverage guide or call our service center, but really brokers and health coverage guides are excellent at community-based work and face-to-face assistance. We would love it if you would create an account and associate yourself with your assister. That way we can help, connect you if you guys get lost, or we can help you through the process if you call our service center. Submit your financial or non-financial application online as soon as possible, if not before December 23rd, the Christmas rush, to get covered by January 1st. And we hope that you find the tools that we provide to you for finding a broker, a health coverage guide, and planning for your medical expenses as to be very helpful. So some next steps, our friends at Cover Colorado wanted to be sure that we did our part to outline the dates that we mentioned early on. So 12/10 is the last date to cancel your Cover Colorado plan without having your January premium drafted. After the 10th of December, if you enroll in a new plan that starts 1/1, your January premium will be refunded to you, and that would be credited to your bank account within 30 days. There is a cancellation tool that's online on the Cover Colorado homepage, and you see the reference there. It's recommended that you not cancel your Cover Colorado coverage prior to signing up for new coverage because no one wants to have a gap in coverage. You can check your enrollment status on Connect for Health Colorado, and the status would show submitted until you have made your first payment. And the carriers are getting live enrollment feeds from us now. So if you've enrolled any time between the 1st of October and now, first of all, thank you very much. And second of all, you will be receiving your first payment very soon. So you can really look forward to receiving that, I'm sure. Once the payment's processed, then your status will change to enrolled. And the carriers send out the billing statements. We don't send billing statements out on the individual marketplace. If you have questions for us, we want to be available to answer those, so you can visit our website. I will say that if you go on our website and you search FAQ in the search feature, you'll come up with a very lengthy and wonderful list of frequently asked questions. And it's just a wealth of information, and it gives a lot of details. Pretty easy to search it. We do have an information email that we answer in triage, so if you want to shoot us a question, there's the email address for that. Please do call our service center. You see it's 1-855-PLANS, the number 4U. You may have heard our ads that say that. We know that that's too many numbers, but it still works. But if you want the number, the actual number, it's there as well. Medicaid determination, we've worked with our partners at Medicaid since for a very long time, but we know that there's a lot of people kind of waiting who have applied for Medicaid and have not heard. And so here's the dedicated number to their partner called Maximus, and they have staffed this number up as of last week, so they can be more responsive and immediate with getting people their determinations, so that we can wrap this this process up and not be really stressed out during the end of the year. If you do want to email Cover Colorado, you see their email address there, and that's for specific questions about this as well as general questions. So with that, that concludes the content of the presentation, and we will go ahead and open up the chat line and answer some of your questions before we send you on your day.